I'd like you to try something with me. Take a nice big breath and hold it there. That is position 1. Now, as best you can, take another breath on top of this one. That is position 2. Now you can start to breathe out, but only let out enough air to return to position 1. Now try to do a few rounds of breathing where you only go between position 1 and 2. Okay, you can stop now. Not easy, right? Well, what you've just experienced for a mere few seconds is the lived reality for someone with a chronic respiratory condition. Or, like Cassie Hawthorne here describes it, it feels like breathing through a drinking straw. Cassie is one of over 70,000 people worldwide with a genetic condition called cystic fibrosis. A key part of this condition is that you are extremely vulnerable to lung infections. Over time, this causes permanent lung damage, and although management is always improving, people with cystic fibrosis currently have a life expectancy of 40 years. The main treatment for these lung infections is to use antibiotics. But there are hundreds of antibiotics out there. Which one does the doctor choose? Well, that's where the lab comes in. At a hospital's microbiology lab, scientists, like myself, are like detectives. We figure out what bacteria are causing an infection and what antibiotics should be used to treat it. We can do this using culture, essentially putting a patient sample on a petri dish full of food for bacteria and seeing what grows. Then you expose it to antibiotics and see which ones stop it growing. However, this process has a few issues that I'm exploring. What do? Well, instead of looking for bacteria in a sample by culturing them, I look for that bacteria's DNA. How is this better? Well, first there's the question of speed. Some bacteria can take weeks to grow in a culture dish. In comparison, a test to look for its DNA, well, that only takes a couple of hours. Also, we're often dealing with chronic combined infections here. So in that petri dish full of bacteria, an antibiotic might work against some, but not others. You can miss this if you're purely relying on culture, but if you instead survey all the DNA in that sample, you'll find these details. It's not all sunshine and rainbows though. Using these new DNA tests at the expense of culture isn't the solution. Yes, you might find the right DNA in a sample, but that doesn't necessarily mean that the bacteria that DNA came from is alive in the patient. It could be leftover DNA from a previous infection, or it could be a fragment of DNA picked up from the environment. So what I'm exploring in my research is how to use these new DNA tests together with culture to help doctors find the right antibiotics faster. This is our best way forward in managing serious infections in cystic fibrosis and ultimately helping people like Cassie breathe a little easier.